You're welcome to the program Health and Wellness on Oweleketv. I am Antonia Wokolo and I'm super excited to have you join today's episode. Today we are diving into a topic that's crucial for every woman's health. That is understanding vaginal discharge. It's a natural and normal part of the feminine experience, but it's often covered in mystery and sometimes misunderstood. In today's episode, we'll unravel the secrets behind vaginal discharge, exploring what's normal, what might be a cause for concern, and how to maintain optimal vaginal health. We are joined by a medical doctor and a reproductive health expert who is also an author and founder of Fertility Code Naturals, a wellness company. Our guest today is Dr. Gilbert Naji. You're welcome to the program, Doctor.
Thank you. It's good to have me here.
So good to have you here. So, Doctor, tell us, what are the common misconceptions or myths surrounding vaginal discharge and women's reproductive health?
Okay, basically, the misconception about vaginal discharge for a lot of women in Africa is that it's one of the issues. Let me go to the basics right now. Infections are actually one of the challenges that women are being plagued with that can result to infertility. That's the major concern. Okay, now for women that have infection, okay, the major thing that they should want to find out is the color of the discharge. Okay, when they want to ascertain what actually is the type of the discharge or the particular reason for that vaginal discharge, they should look at the colors. And they can't do it by themselves on the house. They should go to a physician. That's the proper way to do this, so that they will get assessed, and then run certain tests, which is normally called HVS, vaginal swab MCS, to find out the microorganism responsible for that particular nature of discharge. It's not what women can figure out on their own to avoid antibiotics abuse. So it's very, very important that when the woman begins to experience discharge from a private part of vagina, she should first of all see a physician so that she'll be assessed. The color changes is best known by a medical doctor. Okay, because there are about 5 to 6 different color changes.
Like purple.
Very good. There's a gray type. The gray type is associated with what they call BV.
Okay.
Bacterial vaginosis.
Okay.
That one is not actually sexually transmitted. It comes from penetration when a woman is penetrated with the hand,
okay,
or the finger. It introduces microorganisms
from the finger, okay,
into the vagina, even through oral means, oral sex.
Yeah,
these are ways that the vagina can pick up microorganisms. Okay, silently without the female even knowing. So and these are some of the lifestyle related issues too. And we'll come to that later. That is why if a woman begins to experience discharge, different colors, she shouldn't really be apprehensive and start taking drugs. She should first of all see a physician to get assessed. Okay, and then the underlying cause of the infection is going to be reviewed in the lab report.
Okay.
And then she can then proceed to proper treatment.
Okay, so you mentioned that if infections are what causes vaginal discharge. So apart from infections, are there other things that could cause vaginal discharge? And how can one differentiate between a normal vaginal discharge? Because definitely when a lady is ovulating, there's a discharge. So how can one differentiate a normal vaginal discharge from an abnormal one?
Okay, let me answer the first one first.
Yes.
What are the causes of vaginal discharge, right?
Yes.
There are lots of causes, a lot. Like I mentioned, the oral route can transmit infection to the vagina. Using the hand can transmit infection. And then other ones are like douching.
Okay.
You know what I call douching? Using water and certain combination or mixtures in water to cleanse the vagina. Okay, when that is done, it reduces the pH level of the vagina. The vagina has a particular pH level, which is alkaline in nature. So when you apply, some of those things, liquid into the vagina, it changes the pH of the vagina, because, mind you, that's the pH. The normal pH of the vagina is the correct state in which the body repels microorganisms by God or by nature. So when you interfere, you change that ecosystem. And then the bad guys, which I call the bad bacteria, they come in and they cohabit there. they overpopulate and then chase out the good guys. The good guys is called the good bacteria or microfloras. They are there to protect the vagina. But when you interfere, you kill them off. The bad ones come in and then populate. That is when human begins to have resistant, bacteria without responding to antibiotics. Now that is number three. The other way is through penetrative sex. Okay, it can result to vaginal infection too. The other one is penetrative sex is one of them, and the other one is when you use scented substances like, let's say, perfume.
Okay.
Perfume, scenting the vagina with perfume, it changes the ecosystem too. And then we also use soap. It does the same changing of the vaginal ecosystem. And then there are lots of things. And then we also use certain sex toys that women use. Yes, sex toys, they are being coated with certain lubricants. It changes the ecosystem. Even certain contraceptives like spermicidal contraceptives, like cream that women apply into the vagina to have sex to kill the sperm, it changes the ecosystem. So whatever that you apply into the vagina that changes the ecosystem, that changes the pH level of the vagina, it's indirectly harms the vagina or alters the environment. So that is when women begin to come down with discharges, infection. And then when you now come to how you differentiate between the normal discharge and the abnormal discharge, there's a color. It's a particular color for a healthy vaginal environment. That color is clear. Now, clear is when clear is like watercolor now, colorless. Okay, when a woman begins to feel certain discharge from her vagina, she shouldn't feel apprehensive that something is wrong. It's normal. It might be ovulation. Ovulation has clear, stretchy clear color. That is when that is actually the 14th day of a woman's menstrual cycle. So it's normal. So it's not good enough for a woman to start feeling, I'm having discharge, let me go and take antibiotics. That's not proper. It's a normal color. Okay, if you're confused, see a doctor. That's normal color. Then the other one is whitish discharge, usually cloudy white.
Okay.
White like this table color, cloudy white. That one is naturally normal.
Okay.
Most times it's commonly due to yeast infection or candidiasis. And it comes with itching. One is itching a private part. There could be burning, occasionally burning sensation, but itching is the commonest symptom of cloudy white. So that is when the woman should see a medical doctor, gets to be assessed, do some laboratory tests, and then the treatment will be based on the cause of that particular color of discharge. The other one is sometimes yellow discharge. Yellow is infection.
Okay.
STI or STD. That's yellow. Okay, it means that this woman has infection.
It has an infection.
Probably through sexual intercourse. But then do not start doing self-medication.
Okay.
Because you don't know the right combination of the antibiotics you can use. There are lots of them. Okay, so you don't just use the one that can even cause problems for you. The other ones, it could be bloody sometimes, bloody discharge. As you know now, blood is menstrual discharge commonly. But sometimes it may be something different. Cancer can come with bloody discharge, like cervical cancer. So how do you know? You don't just go. If you know that you're not actually in your menstrual cycle, you should see a physician and see a medical doctor to get properly assessed, because these are sensitive things. On the other hand, so there could be pinkish discharge.
Okay.
Pinkish is when a woman is pregnant and she has what they call implantation bleeding or breakthrough. When baby implants in the womb,
okay,
it comes off with a pinkish
discharge
commonly. And mind you, not every man can figure out that. Even we doctors, we become confused sometimes to differentiate between pinkish and red discharge. So that is the point is to see a physician and then get access. So these are how to differentiate different colors. But it's not your team to figure out. It's your doctor's team to figure out to prevent antibiotics abuse. Right? So
the vaginal discharge is the organ's own way of telling you that a foreign body has entered and disrupted the ecosystem. Is that what we're saying now?
It's not typically a foreign body.
Okay.
Now, the female body is very dynamic, unlike the male body. Each cycle comes with different experience, different observations. That is why women bodies are very powerful, and I respect women body for that a lot. So when a woman's cycle changes, now if a woman begins to have clear discharge, that's another cycle change, because every woman has 4 cycles. within a month of a menstrual cycle, 4 cycles. So a particular cycle, there will be clear discharge, which is ovulation, which happens at the 14th day of every woman menstrual cycle. So it's clear. And when one passes, she might, maybe the next following week, she might start seeing different colors. Let's say white is discharge. Okay, but if the white is not itching, it means that she's okay. She shouldn't bother. But if it's itching her, then it might be infection. So it changes. So if a color changes to any different color, it's not normal. It doesn't mean that this woman has infection. It might just be hormonal imbalance or ovulation color and all that. So the thing to do is to, if it becomes troubling or it becomes uncomfortable for the woman, she should see a physician to get assessed properly.
Okay. So apart from the hormonal imbalances and introduction of foreign bodies into the vagina, are there other lifestyle factors that can impact vaginal health and contribute to changes in the discharge?
Yes, there are lifestyle factors. For one of them is healthy dieting.
Okay.
You need to eat healthy diet, like organic diet that has nutrients like vitamins and minerals. Because these things, they are known as antioxidants. They help to improve the body's immune system. And then there's something called probiotics too.
Yeah.
That one is very, very good for women. It helps to build even the vaginal ecosystem. Okay, to help prevent, the bad bacteria from coming in. And then it's also good to wear, breathable pants or underwears. Do not just wear underwear that will not allow air to get into the vagina. Also has to breathe. It's a living thing too. So very, very important. That's one of the lifestyle changes you need to do. And then the other things too, you need to also avoid sugary beverages. Okay, like sugary generally, like sugary
chocolates, carbonated drinks.
Yes, they are not. They encourage the growth of bacteria.
The growth of the bad one or the good one?
The bad ones. The good ones come from probiotics.
So what foods can we take that have probiotics in them?
One of them is yogurts, Greek yogurts, not the sweetened one.
The unsweetened Greek yogurts.
Yes, that's one of them. And then occasionally too, I think honey is okay. Honey doesn't contain the sugar that harms the body.
Okay.
It's an organic sugar, honey.
As opposed to white sugar?
Yes, no. White is not the ideal sugar the body needs to take. And then veggies. So like I said, veggies, they have more like antioxidants, which is generally good for everybody. It helps to build the body immunity to ward off all those microbes. Then good hygiene, good personal hygiene around this area. You should know the time to, when often you change your underwears, not to wear underwear for up to a week. It shouldn't be too healthy.
Yeah.
You need to change it regularly.
Yeah.
And so women go as far as burning their underwear when that's not proper. Some women, they burn their underwear when they start feeling that they have a discharge. I feel like that infection came from the underwear. No, it is the changes in the vaginal walls. That is where the issue is. The person has to replace, to introduce good guys. Like, I don't know, medically would that actually encourage patients to insert tampons into their private parts, but it has medicinal benefit.
Okay.
Unless the tampons they have NAFDAC certification.
Yeah.
But tampons are also one of the ways that probiotics can be introduced into the vagina, apart from the one that people swallow. Okay,
so are the tampons now made with probiotics in them, or
yes,
how?
They are impregnated with probiotics.
Okay.
Those tampons.
So once it's inserted, as it's collecting the menstrual blood, is releasing the probiotics. Is that how it works?
No, it doesn't work you don't insert it when a woman is in a period.
Okay.
You do that when a woman is not undergoing a menstruation.
Okay.
So you introduce all those probiotics into the system. If you can't do that, then you can take it orally. There are oral probiotics in the marketplace now.
That we can get over the counter?
Yeah, they're like supplements. You can take them, they populate the body with the healthy bacteria, such as the probiotics, vaginal florates. That is what helps to build the healthy bacteria ecosystem. Okay? So that's the ideal thing to do. Then you can also take it as diet, like yogurts. These are the two top dietary recommendation that I can give to people that want to build up their vaginal health, and then stay off all those processed food, processed diets, applying those wrong chemicals into the vaginal environment. Those are things that women should really, avoid.
Okay. We'll take a quick break now. The conversation continues when we get back.
Follow us on our social media handles at Oweleketv. Visit our website at www.oweleketv for a thrilling journey. Oweleketv, rising star at the fairground.
Welcome back. If you just joined us, this is the program Health and Wellness on Oweleketv. And of course, we still have Dr. Gilbert Naji in the studio, and we're talking about understanding vaginal discharges. So, doctor, is it advisable for women? We've talked about this earlier, but I really want us to lay emphasis on it. Is it advisable for women to use feminine washes, herbal flushes in forms of tea bags, syrups, liquid mixture? Because I've seen a lot of things on social media. There was even something I saw somewhere that they said you can insert garlic into the vagina and it helps to get rid of infections. If you're feeling itchy or burning sensation, that it helps to just get rid of it. So is it advisable for ladies to do that? Okay,
first of all, I like to say something that most of those remedies, they've been there for so many years.
Okay.
I don't discount them. Okay, that's what our great grandparents used when they had those issues. I don't discount them. But as a medically trained doctor, I believe in science. Okay, I believe in scientifically enhanced or endorsed remedies. Okay, so what I will advise people to do is that whenever they start to experience discharges, especially the foul smell discharges, the women particularly, the first thing to do is to see a trained professional. Okay, for me, I am not biased towards natural treatment. I'm not biased. Okay, I know that they also work, but then it's good to be on the safe side. Okay, use things that have been proven to work. At best, they have NAFDAC approval. Okay, they work. We have lots of them in the Nigerian market, and I don't want to mention their names. Okay, and they work. They have NAFDAC approval, so they work. But do not just go into self-medication. Let a physician be the one to recommend these things to you, so that when you begin to feel certain symptoms, they can also advise you what to do to prevent it from causing any harm to you. Okay, so some of them work. Yeah, I believe so. Some of them work.
Okay, so the physician should be the one recommending and not just buying randomly.
Yes.
Okay, so how does stress and mental health affect the vaginal health? What role does stress and mental health conditions play in the vaginal health? And what strategies can ladies use to employ to mitigate the effects? So what are the effects and what strategies can one use to manage conditions arising from that?
Okay, mentally, if how stress affects vaginal health, it only have a direct link to the female vagina. It doesn't. But then stress can affect a woman's biological system through the hormones. It can actually cause hormonal imbalance. Okay, that's stress. How does it happen? When a woman is stressed, let's say a woman is trying to conceive, for example, when she's stressed, she's depressed, she has worries because of a particular thing that she doesn't have, okay, or because of a lack of ability in terms of conception, that can cause stress in her body. It can result to stress. And when it happens, there's one hormone called cortisol hormone in the female body. When a woman is stressed, the hormone begins to rise. And when the hormone rises, it suppresses certain activities in the body, which is ovulation. You see? So that's another problem. So when hormones rises, okay, when the cortisol level rises, it begins to cause hormonal imbalance. And hormonal imbalance affecting the vaginal health is just in the area of color changes. Like I said before, one of the color changes that the woman body gives out, the clear, it's when a woman is ovulating. So there is no direct link that stress has to the vagina. The vagina, it doesn't. But stress can affect a woman's health hormonally. hormonally, it can delay conception, but it doesn't have a direct link.
Okay.
Okay. But then to add this last point, the only way that stress can affect a woman's vaginal health is by lowering the immune system.
Okay.
Yes, it can reduce a woman's immune system. That is stress, because for stress to affect a woman's conception ability by resulting to lack of ovulation, it also has a negative impact on the woman's health generally. It can also suppress a woman's immune system. And when that happens, what happens? All those bad bacteria can then thrive. So, but it's not a direct cause of poor vaginal health. If you want to look at the direct cause of poor vaginal health, it's by those things I mentioned. You know, penetration, like finger penetration to the vagina, oral use on the genitals, okay, penetrative sex without condom by infected partner,
Okay.
douching, you know, applying perfume into the vagina, okay, and then what else? Scented
soaps or substances.
It changes whatever that you apply directly into the vagina. It changes that environment. So those are the things to be concerned about.
Yeah.
And then also doing antibiotics abuse, taking a lot of antibiotics without even getting it from a medical doctor. It affects the vaginal ecosystem because it goes far to kill off the good bacteria. And like I said, that place is already healthy. It doesn't need interference. Just how to take care of it, just do a normal wash. Use water. Don't even use soap. Just wash it. And that's all. It's to be fine. Do not go and start applying things. When you do that, you change that
pH.
environment, and then the problem can then arise.
Okay. So finally, before we go, what's one word you tell a lady that has probably been taking a lot of antibiotics and probably has gone to see her physician and he's trying to maintain good personal hygiene, but then she still keeps having infections, still having this burning sensation? What's one thing you would tell them to do to obtain optimal vaginal health? Okay,
like from my experience, like what I've done in my work is I had a patient that was 2 months ago. She had recurrent infection, and when she came to me in the clinic, so what I did was that I had to ask her her medication history, what she had taken. She said she's taking a lot of antibiotics, taking injections. I mean, for like the past 3 months, she had taken a lot. What's 3 months? 6 months. And she wasn't getting better. And I was shocked. And she was seen by even consultant gynecologist. I'm like, how? So when she came, what I did was I started by educating her. Education is therapy on its own. People don't know this. Like what I just shared, these are therapy. So I started educating her. I started looking for what caused those problems initially. And I was amazed to find out what she had actually been doing. A lot of unhealthy practices she had indulged in. So I said, okay, I had to now change her overall treatment. I later found out that what she had was actually a fungal infection.
Not a bacterial infection.
So I placed her on a different medication, and when she began taking that, and guess what? Even her partner was even the one that was even introducing that microorganism to her body. So when you treat the female without even treating the male, it will not go, it will come back. So you cannot treat a woman for infection without treating the partner. You see? That is why women, they keep on having recurrence, because they may have multiple sexual partners.
Okay.
And then, it won't really be eradicated. So if you treat the female, treat the male. So when I started with the husband first, because he had the same problem. The husband, he has taken a lot of agbo, it wasn't going. Then when I brought him in, and now started to change his treatment, place him on antifungal treatment, within 2 weeks,
got better.
He was happy. So then I now use the same approach for the wife, and they were all happy. So it has to do with, it's a couple thing. Okay, it's not just one person. You treat the woman, you treat the man too, because if you treat only the woman, there's only what they call reinfection.
But how about single ladies that are also celibates and they keep having infections? Like the way we say, I use the public toilet and I'm now itching. Maybe I use the toilet. For instance, we're in Abuja and I traveled to, say, Lagos, and I used a toilet there. I used the toilet in Lagos. And now after using that toilet, you start having this itching sensation. And you are celibate. You don't have a partner. You are celibate. So the words that part will say, okay, because you keep getting it from your partner. What does a single lady who is celibate do if she keeps having recurrent infections? Because now there's no partner to treat.
Well, if she's celibate and she's still having recurrent infection, the thing is that you also have to investigate her properly. Because there has to be, the devil is in the details. You cannot escape. You need to know what she's been doing.
Okay.
One, some of them use sex toys.
Okay.
You know, and you can introduce microbes into the vagina with sex toys. Some even use their hands on them. You know, masturbation. You can also introduce that into the vagina. Okay, unhealthy eating habits too.
Unhealthy eating
Like
habits.
so much of sugary foods, you know, it can also reduce the immune system, and then, you know, the bad guys will come and, you know, become landlords and landladies and then populate. So these things, you can't take them for granted. And then the other one, which is one I wanted to mention first, the douching aspect too. A lot of it is vaginal cosmetics. Even what they call, you know what this thing that's popular on Instagram now, is vaginal steaming or what they do. All those steaming things, they're not healthy.
I've seen quite a number of videos like that where they just set a bowl, pour warm water into it, not very hot, pour warm water, slice lemon and put in it and add, then you now sit over it for some time, and they're like, after that you'll be
that's the douching I'm talking about. That's not really healthy. You just water is the best fluid for the vagina. Don't apply all those creams, don't apply all those chemicals and perfume. And whatever you apply, that you just change that environment. And when you do that, the bad bacteria will come in, they populate, the good guys will then be depopulated. The person begins to experience recurrent infection that does not respond to antibiotics. And after 2 months, if it continues, it goes into the fallopian tubes and it blocks it. And if it blocks it, you have infertility. It becomes another problem. You're now battling with two problems.
A greater problem.
And then she's not trying to conceive. And maybe she gets married, she's not able to conceive because she has super block. And then you see a doctor says, okay, we can't conceive naturally. Then the only option is IVF. Can she afford IVF? Is IVF cheap? These are the issues. So the first part is the education. Some, they take drugs after 2 months.
It comes back
because they went back to the same old habits. So education is how to ward off the causes of bacterial infection in the vagina. Okay, so that's it.
So you've heard from Dr. Gilbert Naji. Education is what we need to ward off the causes of vaginal infections in ladies. So as a lady, you have to take care of your vagina. As much as possible, try to visit your physician as often as possible. When you notice any change, visit your physician. Don't just assume. Don't just say, "Oh, I saw this discharge last month. I know you," and become so familiar, and you feel like, oh, you can decipher whatever thing is wrong with you. Don't do that. See your physician. Yes. And if you've been tested that maybe you have PID, you mentioned PID or infections, once you get treated, also let your partner be treated, because chances are that these infections come from your partner, and once you're clean, you're whole, you're going back to that same partner, the infection is going to be reintroduced. And we've said a lot today, and it's been amazing having you on the show, Dr. Gilbert. Thank you so much for being a part of today's episode. So that's the much we can take on today's program. Kindly follow us on all our social media platforms at Oweleketv. Our website is www.oweleketv. My name is Antonia Nwokolo. Thank you for watching.